All right, today we're jumping into a real medical detective story. It all starts with a single patient, a totally routine procedure, and a baffling outcome that made doctors rethink everything they thought they knew about what actually holds us upright. So, meet the person at the center of our mystery. This is a 65-year-old woman. She went in for a pretty common treatment for chronic back pain. And just one single day later, this is what happened. She was suddenly unable to stand up straight, had to use a cane, and was somehow in even more pain than before. This is the question that just floored her doctors. I mean, how could a procedure meant to relieve pain cause such a severe, disabling posture? To figure that out, we have to first understand exactly what was happening to her spine. Now, her condition actually has a specific medical name, and believe me, it's just as dramatic as it looks. It's called Camptocormia. It's this profound, completely involuntary bending of the spine. But here's the really weird part. It only happens when a person is standing up or trying to walk. The moment they lie down, the spine can straighten out again, perfectly fine. It's like her posture was losing a battle with gravity itself. And you can see here just how different camptocormia is from a similar-looking condition. On the left, that's dropped head syndrome. That's all about weakness in the neck muscles. But on the right, you see camptocormia. The problem there is a weakness in the paraspinal muscles, the ones that run all along your back. So we're talking about the difference between a weak neck and a completely collapsing core. So clearly, this wasn't some kind of external injury. Something had gone terribly, terribly wrong deep inside the patient's body. Okay, think of your spine like a tent pole. It's held up straight by a whole system of guide ropes, and those ropes are your muscles. You've got muscles in the front pulling you forward and muscles in the back pulling you backward. When they're in perfect balance, you stand tall. But what happens if somebody just comes along and cuts those ropes in the back? The whole pole is just going to collapse forward. Now, the procedure this patient had was called a radiofrequency neurotomy. It uses heats to basically burn a tiny nerve to stop it from sending pain signals from the little joints in your spine. It's super common and it's usually very safe. But in her case, it seems like the target was missed. And this is where we see the evidence, the smoking gun. On the left is her MRI before the procedure. See those back muscles? Now look at the right, the MRI taken after. You can see this dramatic, severe wasting away, it's called atrophy, of those crucial back muscles. The ropes at the back had been cut, not with a knife, but by accidentally zapping the nerves that controlled them. So once they knew the cause, the next challenge was figuring out a solution. And the answer, believe it or not, came from a very unexpected place. Doctors turned to something called ultrasound-guided dry needling. It's a pretty unconventional therapy. What they do is use an ultrasound to see deep inside the body, and then they insert these super fine needles to target and relax the front muscles, which were now pulling her forward without any opposition. The hope was to try and restore some of that balance to the tent pole. And the results? They were absolutely stunning. This is the exact same woman just 1 month after she started the dry needling treatment. Look at that. She could stand perfectly straight and walk confidently, no cane needed. It was just a remarkable recovery. And her recovery wasn't just something you could see, you could measure it. Her pain score, on a simple 10-point scale, went from a 7 all the way down to 0 within a year. And her function score, which measures how well she can do daily activities, more than quadrupled in that same time. Just incredible. So, okay, one medical mystery solved, right? But this one single dramatic case, it really opens the door to a much bigger question. Her bent spine was caused by an injury, but what does it mean when the spine just bends, seemingly all on its own, with no procedure to blame at all? And this is where our story takes a huge pivot, because we're about to see that for some people, this bent spine isn't the result of an injury, it's the very first clue to a hidden disease. Welcome to the world of inflammatory myopathies. Now, these are a group of rare autoimmune diseases where the body's own immune system basically gets confused and starts attacking its own muscles. And as a recent study found, a bent spine can be the very first sign that this internal battle is happening. But the study found something even more specific, and this is crucial. When a bent spine is the first symptom, the patient's age tells a hugely important story about what's probably going on, and, critically, what can be done about it. And the difference is just stark. For patients who get symptoms before they turn 70, the cause is often a treatable type of myopathy. They respond to aggressive therapy, and almost 19% of them actually see their bent spine improve. But for those who get symptoms after age 70, it's a tragically different story. The cause is most often a disease called inclusion body myositis, and right now there are no effective treatments for it. Not a single patient in this older group saw their spine straighten out. This chart just puts that difference in sharp relief. Look at the overall disease outcome. For the under 70 group, a whopping 62% got some kind of remission with treatment. And for the over 70 group, that number was 0. The age when this starts isn't just a number. It's a powerful predictor of the patient's entire journey.
So what does this all mean when you put it together? Well, we've seen that one identical symptom, a severely bent spine, can actually tell two completely different stories.
Path 1 is the story of our first patient. A physical injury, a rare complication, yes, but one that could be fixed with an innovative, targeted treatment. Path 2 is a biological mystery. It's a symptom acting as an early warning for an autoimmune disease, where the patient's age becomes the single most important factor in their diagnosis and their future.
And that brings us right back here, back to the individual. Her story is such a powerful reminder that even when a condition seems completely hopeless, understanding the precise cause can unlock a path to recovery. Her case was the exception that helped us understand a much larger rule.
You know, as the researchers put it, separating patients by age lets doctors create tailored approaches. For the younger group, it means aggressive early treatment can make a huge difference. For the older group, the focus shifts to managing symptoms and preventing complications, all while the search for a cure goes on. Which really leaves us with this final thought. This entire journey of discovery started with one person's unexpected, bizarre outcome. It just makes you wonder, doesn't it? How many other medical mysteries are out there, just waiting for us to connect the powerful story of a single patient with the revealing patterns found across many?